Hey everyone, I hope you're having a great start to your week. This is Garrett McLaughlin. In the exercise of the week, this week we will cover what's called hip CARs. CARs stands for controlled articular rotations. Now, you've probably heard me talk about flexibility and mobility for runners before. Again, I want to make sure we can fluidly move through the range of motion, but overall it doesn't require a whole lot of flexibility or just total joint range of motion. With that being said, we're all people outside of running, right? We want to make sure we're preserving the health and this overall workspace in our joints. So we don't want our joints to be so tight and restricted that we can't comfortably move in different ranges of motion, right? So we want to make sure we're doing drills and doing exercises to help preserve optimal joint health and joint mobility, and that's where hip CARs come in. So with hip CARs, again, can be a somewhat complicated movement, so I'm going to run you through kind of one step at a time. Always recommend holding on to something, whether that's a PVC pipe, whether that's a broomstick, whether you're, again, in your kitchen holding onto the cabinet, or you have something where you can grip to give yourself a little bit of stability and control as you go through this movement. Because what you'll notice as you go through this multi-directional motion at the hip joint is the body wants to compensate. You're going to get into certain positions that are going to feel tighter or more restricted than others. When you get into that position, it's not uncommon for the back to arch, to cheat, the body to tilt one side or the other side. So we need to do a good job at limiting these compensations as best as possible to make sure we're only moving throughout that hip joint. So it's a very isolated motion at the hip specifically. Okay? So just to show you the motion here, what I'm going to do here, we'll hold the PVC in the left hand. I'm going to move my right hip. Before I start, I'm going to take a nice inhale and almost try to trap some air into this lower abdominal area, right? Try to create some tension there through the core and the abdominal area. I'm going to also what's called irradiate. I'm going to create some tension throughout the system. So obviously I'm going to be standing on my left leg. I'm stabilizing here. I can bring my hand out to the side. I'm going to actually create some tension, engage these muscles. What this does is create stiffness throughout the system so I can better isolate and move this joint throughout its full range of motion. So as I come up here, again, breathe. Trap air, engage, engage. I'm driving down, I'm engaging muscles everywhere, glute, quad, throughout the ankle and lower leg, right hand. And then from there I can start my motion now that everything else is more rigid and stable. What I'm going to do first is I'm going to flex the leg in front. As soon as I get enough space, I'm going to allow that hip to externally rotate. And I'm going to flex and externally rotate at the same time. Obviously, I want to get as much rotation as possible, but we're actively doing this. So you're going to notice that some of these motions are going to be pretty tough to get into on your own. We're not stretching, right? We're actively moving through our range of motion, which is often different than just our again, really a passive range of motion. If I can just lift my knee up to chest, how far can I go versus how high can I do it on my own? We're looking at the difference between those ranges of motion here, and we're trying to improve and close down that gap. So coming up, external rotation, hip flexion, as high as I can through the motion. As I get to that point, again, maintaining tension throughout the system, I'm pushing the PVC pipe down, I'm engaging here in my core, I'm abducting, horizontally abducting out to the side without letting my whole body twist. I don't want my shoulders and my hips to rotate with it. I'm just moving this right hip joint. As I get to there, we're going to start to move into internal rotation. So this is when people start to tilt to the side, to shift away. Internal rotation as that leg is staying up, hopefully in the same plane. I'm coming out to the side, internally rotating, ending in extension, trying not to lean forward or arch my back, and then I'm going to come down. From there, I'm going to reverse that motion. Extension throughout the hip, coming up and around, internal rotation, abduction. As I start to switch to external rotation, flexion, slowly come back down, right? It's a pretty tough motion. You're gonna get through a couple ranges there. You're gonna feel like, man, this is tough, almost borderline cramping with some of these muscles, just because our body's not used to getting into these positions as often. Running is, again, so linear. A lot of things going on as you run, but we're not moving through this multi-directional range of motion quite like this. Now, if we look at this from the side, and then again, look at me. You'll see me compensate in some spots. I'm trying to prevent that to the best of my ability, but it's going to happen. We just want to limit it as best as we can. So breathe in, trap air, tension, tension. Glutes are engaged, core is engaged, driving that leg into the ground, driving the hand down and holding strong, and then also creating tension here. I'm going to come up, flex, externally rotate as high as I can, abduct, horizontally abduct. You can see I'm starting to go into internal rotation, getting back into extension. That's a tough motion for me, internal rotation to extension. I'm trying to get this leg behind the body, and then I'm gonna come down. What I don't wanna see here is as I come here, big arch or big lean. I'm tall, my core is engaged, I'm controlling that motion, my body's not moving in any way. Coming back around. Okay? So you can see we're really challenging the hip through its full range of motion. When would I want to use this exercise? I probably want to add this to my daily movement routine. First thing in the morning, if I'm just checking in with my joints and getting things moving for the day, going through 2 to 3 repetitions, again, going one way and reversing to the other way, matching that side to side. You might notice a difference from side to side. So if you do, adding a couple additional repetitions or just slowing it down throughout those ranges which are tighter on the other side. This could also be a good warm-up before you run. Right? So we want to just start to lubricate that joint, move it through its full range of motion. I probably would do this early on with my dynamic warm-up. If you need any kind of soft tissue work first, add that first, add your joint mobility, flexibility, all of that, and then finish with some of your loading exercises, your walking lunges, to your skips and your plyometric type stuff after. But awesome joint hip cars, controlled articular rotations. We can do this at all joints throughout the body, but just showing you the hips specifically today. Do this from side to side, see how you do. Make sure you're creating tension throughout the system. And then moving throughout that range of motion, right? See, are there any more compensations on one versus the other? What I noticed surprisingly as I do this, right side is a whole lot more crampy as I get up from horizontal abduction, external rotation, and start to pivot into internal. Tons of that going on for me in the outside of the hip. I don't feel that as much on my left side. Left side actually feels more free and more mobile. So really identify those differences and those weak links from side to side. And this can be a great exercise to add into your routine just to check in, move the joint through the range of motion, or use as a dynamic warm-up drill at some point of your strength training routine if you need a little break, but you still want to do something active to work on mobility. Hip cars can be a great exercise and drill to help you accomplish that. So I hope you enjoyed the video today. Questions, comments, concerns, feel free to drop them below. And I hope you guys have a great rest of your week. Thanks for watching.